With the new year comes a new deductible, and the question, can it ever be waived? The agenda today, let's go over the not so good news and the better ones, and of course some tips to help you along. Welcome to the channel. I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. So for the not so good news, your deductible is kind of set in stone. It is one of the terms of coverage that cannot be changed during the course of your policy. And usually you start shelling that deductible out pretty early during the year. It is part of your overall share of cost. The deductible is the portion that you pay first before the insurance starts making payment on your behalf. Once you have met your deductible, your co-insurance kicks in. That is a percentage that the insurance pays, while the rest is left again for you to meet. You may also have some office visits or ER copays, a set amount that you must pay when you visit your doctor. For example, the deductible is usually the bad news starting at the beginning of each year. But there are ways to potentially reduce it, even if it cannot be changed. The first one is through preventive care services. If you have seen any of my several videos on the topic, you should know that preventive care is free. Therefore, there is no deductible when you go to see a physician for screening or for labs, tests, evaluation, vaccinations, or for education on a healthy lifestyle. Those services come at no cost to you, because the goal is for your insurance to save money by helping you maintain your best physical and mental health level, prevent diseases, illnesses, and chronic conditions from developing, detect health problems early, and apply early interventions to ensure the best outcomes at the lowest cost. These services have no financial liability to patient. A deductible can never be applied. Now that was thanks to Obamacare, but there is another federal law that can help you in case of emergency services, the Federal No Surprise Act. It says that emergency services must be paid at the in-network rate, even when the provider or facility is out of network. How can that help you reduce your deductible? Well, in cases where you have already met your in-network deductible, because your insurance is forced by law to pay out-of-network providers at the in-network rate for emergency services, your insurance must cover the cost with no deductible liability to you. You have already met your in-network deductible. They cannot add to it, and they certainly are not allowed to apply those costs towards your out-of-network deductible. Services for out-of-network providers under emergency conditions must be considered in-network. However, that does not mean you may not have an emergency room copay or a co-insurance. If the in-network total yearly out-of-pocket or share of cost has not yet been met, you would be responsible for that. But again, at the in-network rate. That same law, the Federal No Surprise Act, will also help in cases where out-of-network services are rendered to you at an in-network facility and not under emergency conditions. Your insurance again is forced to pay those out-of-network providers at the in-network rate. So again, If you have met your in-network deductible, those out-of-network costs cannot be applied towards your in-network deductible nor towards your out-of-network deductible. So again, you would have no more deductible. But again, same disclaimer, you may still be liable for an in-network copay or co-insurance if your total yearly out-of-pocket or share of cost has not yet been met. The fourth way to possibly waive your deductible or reduce it is to file for financial assistance. These are programs put in place by all hospitals and some other medical groups as well as labs or other medical facilities to help patients avoid financial crisis or even bankruptcy due to large medical bills. Qualifying patients who cannot afford to pay for hospital or medical care can be extended a charity discount or some form of fee reduction. If you have no insurance, if you are underinsured or, for example, have a very large share of cost or have a very large balance you cannot afford, do consider filing for financial assistance. The criteria for eligibility vary from hospital to hospital or for every provider, but they are usually based on the size of your household and income, your monthly expenses, some assets such as how much you may have in your savings account, the ratio of total medical debt to income, as well as internal policy. I have found that trying to negotiate a deductible down or off is really difficult, but self-pay discounts or prompt pay discounts, when you pay most of a balance all at once now in exchange for a reduction, can also help reduce your deductible, as well as, again, a financial assistance grant. Are there tips to help you along? Of course. The first one, when making an appointment for preventive care services, make sure communicate this exact reason for making the appointment. At the time of the visit, remind the nurse, PA, or physician about the reason for your visit, as a code must be sent to the insurance indicating these are preventive care services. Otherwise, you would get a bill. That is why checking your explanation of benefit that shows how your insurance processed that claim is essential. If you see, for example, office visit instead of preventive visit, or if you have any kind of copay or liability, it is a red flag. You should contact the office to have them resubmit a corrected claim, or contact your insurance to have them reprocess the claim with no deductible or liability to you. And when filing an application for financial assistance, make sure all the documentation that is required is attached. Too many times, applications are denied just because a piece of paper is missing. And if your circumstances today have changed since that hospital stay or visit, do include a letter that explains that you have lost your job or cut down your hours, that you are now on disability, that a new baby has joined your household, or that more medical bills have accumulated. And if the facility grants you any kind of a reduction or discount, send a copy of that grant letter to any of the physicians involved in the care at that time and ask them to extend the same courtesy discount to their bills. They will usually do so, whether a deductible or not. I so thank you for watching. Your likes, comments, and subscribe help this little channel grow to reach out to more patients like you. So thank you.